Hi Max.
Hi.
I'm Sarah.
I'm Max. What's the job title for what you do?
So I'm a grief tender,
You're a grief
or I'm
tender.
a facilitator of grief spaces.
A grief tender and facilitator of grief spaces.
Yeah.
That's really beautiful.
And how about you? How would you identify yourself in this context?
I'm a bodyworker who works particularly with bereavement and grieving. Yeah, and an embodiment teacher. And to me, those two things are linked.
Yeah. So for me, grief happens, the experience of grief happens in a body, in a system. So for me, that's why it's really interesting to look at ways to work with it in an embodied context.
Mm-hmm.
And so I'm really interested in how you work with grief. And is that something that you've deliberately moved towards?
No, actually, I think at base for me is embodiment. So my own journey around becoming embodied, getting freed from being exclusively in my head, or at least that's how it felt, to really inhabiting my whole self, I guess, body and mind, and the gestalt of that intersection was so profound for me that it was inevitable, it feels inevitable that I would want to teach other people how to be more present in their bodies. And the way that I do that currently is, and have done for many years, is to support people to be present through touch. So I'm a massage therapist, and it isn't just a case of this person's got a sore shoulder, I'm going to work on that and send them out, and now they've had a bit of a release of this muscle or whatever, and now they're a bit less tight in their shoulder. That's a really important job, but it's also not where I want to be. I very much want to work with a whole person. And so the embodiment piece underpins absolutely everything. If somebody can come to me and have great body work, and also in the process of experiencing that, be invited into the present moment, be invited into noticing themselves inhabiting their body, that's a exquisite thing, which they can then take away. There's that sense of then leaving with noticing themselves walking down the street, noticing the sensation of each step on the pavement, noticing the wind on their neck or the sun on their face on a warm day in London, on a good day in London. That is incredibly meaningful to me. So I think working with grief seemed to be a natural outcome, because I had people choosing to come to me who were bereaved, and not just having lost a really significant person. It might be not related to a death.
Yeah.
Another kind of loss, the loss of an identity, the loss of a relationship, the loss of something that they thought to be true. And as you say, we experience that in the body as much as we experience it in our minds. The two are inextricably linked. So for me, it has become a natural outworking of the embodiment underpinning, I think. How about you?
Yeah, so I love that you bring that grief is not just bereavement. Bereavement is certainly a really major piece in the grief landscape, and for most people it's often the way they become really aware of this whole terrain of emotions and feelings and sensations. So it's often through bereavement that someone goes, oh, this is grief. But I'm really interested in widening that conversation to recognize that grief might be something that's impacting me personally. It may be something that was an absence for me, or is an absence for me, a longing. It may be personal themes, but it might also be something that affects us all collectively. So it may be something that is going on in the world, something that's bigger than me. So it can have many different flavors, but each of these flavors, as you say, lands in our system. It may be sensations, it may be felt sense, it may be not feeling as well. Not feeling is often part of that experience. And I love what you say about walking down the street and noticing. So for me, what I try to bring and help people to see is an awareness. Oh, I'm noticing these sensations. Oh, maybe that's grief. Oh, I'm noticing a feeling that has just been at the back of my awareness that I didn't even know was part of the loading of layers and layers of grieving and situations that are impacting me. So bringing a kind of, as you say, a whole body or a whole system awareness of what's affecting me. And if we're able to notice it, to bring awareness to it, it can give us a little more space to work with it, to choose. So for me, there's a choice around when is it appropriate for me to move towards feeling, and when is it better for me to step back and take care of myself in a different way. The psychoeducation around this for me is partly having the choice to move towards it when it feels safe enough. So for instance, if I'm in a session with a fantastic body worker, that may be a moment where it's really appropriate for me to move towards feeling where I'm held, where there's safety, but also to know that there are times and places where actually I need to really take care of myself in a different way, and my instincts to keep myself maybe a little bit more closed are appropriate, so that we develop a kind of facility to move and to choose to move towards expression or experiencing feelings.
Like a discernment.
Yeah.
Like I can sense that it's a safe place to be able to express something about this.
Yeah.
As opposed to the best thing for me to do right now is to fold this in.
Yeah.
There's a place, isn't there? It's not just let it out. That we hear this word release a lot, and actually release is not helpful if it's not in a safe environment.
Exactly.
And also there's something very interventionist about release. There's something to be gotten rid of. There's something to be brought to an end.
Yeah.
And I think what I'm sensing about both of us is that we obviously have intention, but we're both quite non-interventionist in how we approach things. There's an invitation, but there isn't a goal, I think.
Yeah.
If there is a goal, it's a goal to support feeling and a goal to support discernment and calibration.
So I think particularly in the alternative world, there's a lot of judgment around what feelings should look like, what release looks like. And my experience is that it looks different for different people in different situations, to really honor our differences and our different makeups, our different experiences, our different neurobiology. So, not just getting familiar with what are feelings and how do I feel, but building my own resilience so that I feel able to explore what is my particular way, what do my feelings feel like, and how does my expression manifest. And for me, a really key part of that is to build resources, to build resilience, and to really get deep into the experience of having support. And so this is where, for me, a one-to-one body worker is super helpful to support the work that people may do with us in groups. Actually having someone one-to-one who can really help them. Well, I'd love to know how you help someone, or how you approach this. But for me, support is the beginning piece. So we need to really kind of beef up our support so that we are able to begin to explore how our particular emotional landscape is and how we might want to discover or be curious about our experience in that. So yeah, I'm curious to know if that resonates with you.
It does very much, and I think the way you work in groups is very intentional around building self-awareness and recognition of safety, or recognition of this is a space where I can go deeper with this, or this is a space where I need to fold away. So that, yeah, again, that word discernment, and recognizing what feelings feel like in the body, because there's a skillfulness in noticing to go, oh, there's a sensation, and maybe we don't know what it is yet, but to stay with that. So I get the sense that that's very much one of the components of what you work with in your groups. And I'm interested too in the, I know you asked me a question, but I'm interested too around the group, the dynamic of the group, the power of the group, the wider piece of what the group brings in that process, where everybody has an individual journey that they're on, but there's something about being seen by others who are also grieving that holds space for that.
There are lots of things from what you just said, but beginning with learning what my feeling, what sensation is that for me. I think through Hollywood presentations of grief, there are some very dramatic ways that it might look. It might look like huge anger or terror or wailing and weeping. All those things are normal, possible responses, but there are also what I describe as more granular emotions, more subtle, more so. The way I've been socialized, my experience in life means that actually it's quite rare for me to be a real weeper and wailer. It doesn't make me wrong. That's just, this is how I am and my emotions. And that sometimes grief may be like a bruise, like a painful bruise, or something much more subtle. And so me learning how does grief show up in this particular body can be really helpful in this, real micro experience that you might get one-to-one. Really supporting that learning of what's going on inside me. And what happens we're in a group. There's so many different things that happen in a group. We become in a sort of group field, if you like, where we can both sense one another, see, witness, hear one another. And there's something about, it can be extraordinarily liberating to experience grief with others, experience the expression or naming of grief with others, because we begin to go, oh, it's not just me. I mean, that's probably the most key thing, because so often we silo ourselves alone. And this isn't true for everyone, and it's not true for every family, community, culture, but for many people, there has become a sort of tendency to hide grief away. Especially in a world of social media where, you know, we may get strokes for having a fabulous time. There may also be people who get strokes for really oversharing. So rather than these two polar extremes, what happens where we share together the possibility of a more vulnerable, more authentic, this is actually how I am behind the mask. If we can do that in the presence of others, it can be a very powerful, very deepening experience. It can really shift something for people. Not for everybody, not all the time, but it can really change that sense of isolation. And there's just something that happens. There's a kind of organic experience that happens, an organic process in a group that is hard to describe, it's hard to explain, but there is a kind of magic that happens when we come together. And increasingly, there are modern researchers who are recognizing, oh, collective ritual is something that humans have always done, that is meaningful, and that can really change states. So,
seeing and being seen is what's coming to mind. And there's a balance there, isn't there? Because if we're overseen somehow, then it can feel very exposing.
Yeah.
I don't want to be seen in my grief. It's too tender. I don't want to be seen. But if the seeing is non-invasive, if it's more like a recognition of common humanity, then suddenly that's where something powerful is happening and something profound.
Yeah.
I was also thinking as you were speaking about not getting stuck in an idea of what it looks like. So a little bit of opening of, oh, this is what my grief looks like. It's what it looks like in this moment, but it might not be what happens next. And that's the other thing, is as the learning, as the awareness develops, to not then attach to it and go, okay, I've worked out what mine looks like, because it is so circuitous and complex. As a simple story, I lost my dad when I was 36, and I had a regular massage therapist I've been to for years and years, and I love the intimacy of that. Actually, that's an important relationship, or at least it very much was for me. This is this person I see every month. This person had massaged me through my pregnancy. She had massaged me through every tattoo I'd ever gotten. And indeed, she ended up massaging me through the death of both of my parents. But so I'd lost my dad, and I was 36. So, and my daughter was very young, only 15 months old. So it was such a time of seeing this little life emerging while this really important life exited for me. And I had gone for a massage, and it hadn't occurred to me, and maybe this is part of the origin story for me of how the weaving of working with grief came into my bodywork. So I was on the table, and, you know, hi, whatever. I don't think I mentioned that my dad had died. Maybe I did, but in that way, oh yeah, a lot's been going on, etc., etc. My shoulders are really tight. I had to, go back home. My dad was sick, and then he died. In that way that you might in a couple of minutes, because that's the nature of the work. It's a massage therapist. You don't, talk in detail about a loss. Got on the table. She's massaging me. She was so kind. She's ceased to work in London, so I don't see her anymore. But I saw her for 10 years, long time, and as she was she had kind touch, and I think that's something that's really precious for me as well. That my touch is kind, for whatever somebody's bringing. Actually, regardless, can we meet each other kindly? The world is complex, and life can be tough, and can we at the very least meet each other kindly? So her touch was kind, and there was this moment where grief expressed itself, but I didn't feel I could say. I didn't want her to worry about me, and so I just quietly, silently cried while she massaged me, and the tears were dripping through the face cradle onto the floor. And by the end of the massage, there was this puddle. And I never said anything. And I don't know whether she, probably ended up feeling it with her toe later and went, oh, what's that? Or whether it had dried by the time the next client arrived or whatever. But there was this puddle, and I thought, that's interesting. Clearly I needed to cry, and the bodywork really helped. And I feel good for having been able to let that out, because for me there wasn't a lot of space for that to happen. A lot of responsibilities and other people relying on me, and so there wasn't a lot of space for me to be able to express in that way. And so she was none the wiser. And then by the time I had to turn over onto my back, my eyes weren't sufficiently red, she didn't notice. So then the next time I saw her a month later, I thought, I'm gonna just say something, because I'm going to want to cry. So maybe this time I'll let her know. And then when it happens, maybe I'll feel freer. If there's a little bit of a sob, that might be all right too. And then, she knows what to expect. So I just sort of said casually. Last time I wept a little bit during the massage when I was face down. And I just wanted to let you know, because perhaps this time that will happen. And maybe, so if that happens, please just keep working on my body. Please don't... I think what I need is the space to not have you stop and then it changes into something else. I think I'd like it to continue, and for that to be the holding, and then I could just cry. And she said, sure. And guess what happened? No tears. So it was a real, it happened this time. That was what was happening that day. But the preempting of it, almost like this, right, so this is what's going now, I know what's going to happen. That's not what happened. So that holding lightly that grief has its way with us. It does what it's doing. It's got its process. I wonder what your reflections are, or your experiences around that.
So the whole practice of grief tending is around holding the group, holding one another really lightly, having space where grief is welcomed, where grief is possible, holding that very lightly. It can show up in whatever way or not show up at all. It doesn't matter. The idea is about really offering space with kindness, simple kindness, but not in a way that is sympathy, not in a way that is taking care of, not in a way that is offering solutions or responses or suggestions, but just to have the space where that is possible to come and bring grief however it shows up. And it's actually quite rare to find spaces in life, I think, where people feel able to just be as they are without that kind of expectation of I need to reciprocate or respond in some way, but to just allow spaciousness. And if that can be brought with kindness for ourselves, for one another, it can be quite a radical experience for people, especially if they're used to, perhaps often people are the caretakers, or they've been socialized to be the caretaker, or there are expectations. We often pile ourselves with expectations that are super unhelpful. What are our expectations of what our grief needs to look like? Whereas actually, if we're able to just be with whatever arises in the moment, that itself is often just really unusual and can give people a taste of something different, a taste of a different relationship to what can be really challenging emotions may also include, you know, what happens if we open to relief, gratitude, love, that is kind of the flip side as well, you know, to just to open to whatever is. And very often if it's our own internal messages that get in the way, you know, I've read a book that says it should look like this, or, you know, unfortunately Elizabeth Kubler-Ross's stages of grief, which were designed around the dying process, have become very popular ideas about what grief needs to look like. It's now been really you know, recognized that it's not like that, that grief is a much more unpredictable, messy, chaotic, 1 minute's this, 1 minute looks like that altogether. But still we often grow up with these internalized messages about what is acceptable to show, you know, what my face is supposed to look like when someone has died or left me, or so it can be just a really different experience to go, well, how am I actually feeling right now, right in this minute, and knowing that it will change. And what happens if I'm able to be with that in the presence of other people, allowing me to be with that, with other people not being so anxious that they're trying to fix, rescue, but just to be a holding presence.
I think that Elizabeth Kubler-Ross's work has in the I guess in our collective consciousness has been misunderstood in a way, because she never said it's this order of, you know, it's these are the thing, these are the components, these are some of the components, and they will jump between, you know, you think you've made progress. What does making progress look like with grieving? And you know, I found her work really helpful, but you're absolutely right. It was taken and codified into something, again, quite static, which was what we were talking about a moment ago, when there's a chaos to grieving, where, and there's a force to it that it is aided by surrender. But I think within that there is, as you say, not surrender where there's a complete giving up of. It's about knowing when to be able to express, for example, when you're safe enough, when you're in the right environment, and knowing when you need to fold in. But within that is a surrender to that process. But also what you were saying about the holding, I think we have an idea about how we're supposed to respond to others' grief as well. Yeah. I will bring round some soup. I will send a, you know, beige coloured card. I will, there's certain language that we use. Yeah. So for me, clean language is relevant, where listen to the words that a person uses and reflect those same words back to them. Don't change the language. Go be with the words that a person uses. But in terms of what else you might do, throw out the rule book, and can we let go of the need to be helpful? What would it be like for my offering to be the holding? It seems too small for the bigness, for the enormity of grief. Could I really just hold space? But actually, to just sit with somebody and let whatever happens, and to sit grounded and comfortable. They're going to vibe on that. They're going to feel, if your nervous system is relaxed, then that opens up something. It's not I must do this and say this. And I think in a way that we get lost. And so sometimes when there's a really significant loss for a person, people don't know what to do, or they do those things and then they've already been done, and what do I do now? And so actually then they disappear.
Yeah.
So the grieving will often say, nobody's saying anything. It's like this person isn't gone. It's like this never happened. It's like this event didn't happen. Nobody's acknowledging it anymore. There was a flurry for a week, and then now there's nothing. That absence speaks a volume to me. It's about that, perhaps really commonly, our inability to sit with, without intervening, to just make space and hold it.
So for me, a great practitioner will be able to do exactly as you say, to sit, be present with, to be grounded enough, to be stable with their own experience enough to just be present and available and offer space and holding. And I think that's so important. And what you describe is often the anxiety that comes from our own discomfort. It's if I'm not comfortable with my own grief, with my own history of losses, with my own fear of losses that I may encounter in the future, how can I possibly be with yours? And I think this is where, psychoeducation is super important. Things like the Death Cafe movement have been really great at just bringing the conversation around, let's talk about death and dying and grieving. There are really simple tools and skills that we can learn, but part of that is just learning to sit with discomfort. And for me, that's kind of the key skill, learning to sit with my own discomfort, doing my own work so that I am processing and digesting my own experiences in life, so that when it then comes to supporting others, I'm not being activated by what's going on in you. I'm just able to really be there for you.
That's it. Because you don't need to fix.
Yeah.
When you can let go of the need to fix, then you're also letting go of agenda.
Yeah.
And when you don't have an agenda, there's nothing that you need met out of that interaction. Yeah. Oh, I've got an idea about who I am as a person, and I fix things.
Yeah.
And if it's something I can't fix, now I'm feeling anxious.
Yeah.
It's not a condition in which to enter support of somebody grieving. Letting go of the urge to want to fix. I'm wondering whether that delightful cat needs to join in this conversation.
Shall I let her?
I think you should. Otherwise, we're going to get... Nothing's complete without a cat scratching to be let in, is it? Come on. Hello. There's a space for you if you'd like to come up. You asked me earlier about how I work with the grieving, and I didn't end up answering it, and so perhaps I give an example.
Great.
So I think one of the first times that it happened was years ago. I was massaging somebody, had a lot going on in their life, and and had a lot of pain, and some of it was showing up physically. And I was doing a particular technique on their shoulder blade, and I don't know how to explain, but I felt something. So I said, and this is very much about how I work with embodiment, I said, what are you noticing in your shoulder right now? And the person didn't say anything for a little while. There was just this silence. I continued to work really slowly, and I just let the question be there, and they had no obligation to answer, actually. And then they said, sadness. And I said, oh, okay. I wonder what might it be like to just stay with that, to allow that. And there were some tears. very gentle tears. I just kept working so slowly, just working with feeling that, not sure of the right word, activation, feeling it, not trying to fix, just meeting it, letting it be seen somehow, letting say, I see you, I'm not doing anything else other than just witnessing. And the tears came to a completion, I guess. And so too, again, I don't know how to explain, but I can say that their tissue felt settled. Now, I don't know the cause of the sadness, but there was a happening there in the space that was created. And I think that's very subtle, and depending on how you view the world, that doesn't sound like much. And yet what was able to happen in the space that was created was really significant for that person. So I really appreciate what you say about the space holding being where you've let go of, you're not holding this need to fix. Now we're well sorted. But we're going to have some disturbance in our audio, aren't we?
So what I hear you describe in that, there are a couple of really key things about how we come on side with our feelings. One of them is obviously the possibility of being held. That makes a huge difference. But also slowing down.
Yeah.
Slowing down so that often our parasympathetic nervous system may soften and allow us to get into a different way of being from our busy, activated, energetic, everyday going about life mode. And also what happens when you maybe use the breath and just bring presence to something. It doesn't have to be a huge cathartic thing, but what happens, things can really unfold, unwind, soften, shift, transform by bringing attention, by bringing the presence perhaps of a hand or the breath, our awareness. So yeah, that, you know, what a great way to be with someone, be with grief, be with their feelings, whatever they might be caused by or however they might manifest in them. And I'm aware of certain parts of the body that grief is very much associated with. Do you notice particular points, or, you know, as you mentioned the shoulder there, are there other places that you may be connecting with? Oh, what's this here? Or
many different ones, and I think it depends on the nature of the grieving. I think that intersects with trauma as well. Grieving and trauma being co-located. But in my experience, while there are certain parts of the body that I might see more regularly as showing up in this context, I don't discount the possibility that it can be expressed by any part of the body, you know. And even too by not just a constriction or a pain, for example, but even finding that the ability to breathe is constricted is something I've noticed. That breathing deeply can feel hard.
Mm.
But again, there is something constricting as part of that experience. So I think I'm also interested in how being able to fill your lungs again, being able to look up again, what that looks like as well. And again, not with attachment to being able to look up again is the goal, not that.
Yeah.
What's your experience with the body in relation to grief?
I love hearing you describe feeling able to expand your lungs, to look up. I mean, what I notice is that as people get more curious about their own grief, as they follow their own breadcrumbs to find where it might be located in their life experience, how it can opening the door to these natural responses to impacts, whether trauma or whatever they may be from, but how by opening a process of inquiry into that, it actually can also really open up this balancing aliveness, this sense of, oh, if I breathe into grief, oh, I can also maybe taste more, maybe, welcome in something else, because, you described this. I think there's often a sense of contraction, and that may show up in different places. And I use my own body to explore, sensations and massage, and how can I support my own experience as well, maybe with a hand or belly or heart. How can I find ways to touch into my experience that allows more just more engagement with life as a whole. If I'm not saying no to one part of experience, what if I say yes to my life as a whole? And that can be it can be quite a hard thing in theory to grasp, but actually my experience of working with groups as we grief tend, what often also emerges is the joy, the laughter, the silliness, the play, the fun. And maybe that's too ambitious for some, but often there's connection. There's more a sense of, I may be able to return to being alive, to being perhaps a little hopeful, lighter, maybe warmer. There's something that can come through being with grief that often brings connection, and connection to other humans who also experience the challenges of being alive.
There's a real richness in that. It reminds me when I was in hospice with my mum when she was dying. I spent quite a lot of time with the staff because I was there for a whole month. As it happened, living on site, just because I had travelled from the UK to New Zealand, and I hadn't sorted out an Airbnb, I hadn't bathed, I hadn't anything, and they said, oh look, the doctor's room isn't used, you can just crash in there for tonight and we'll worry about things tomorrow. And then as it happened, they were like, do you know what, why don't you just, I literally ended up living in a hospice for a month, and I spent all my days with my mum, and in between I'd chat with the staff. And one of the things I noticed, it was really noticeable, was the lightness that they had, was the quite wicked jokes. I mean, quite wicked. And there was a joy about them. And isn't that interesting, because we're in a space where People are having end-of-life care typically, or they're having respite associated with life-limiting conditions, which would include their life ending sooner than expected. And so one might imagine a somber place. It was quite the opposite. And I just thought, goodness, palliative care people, they're onto something.
I mean, I think
playfulness.
There's something about, if we are able to recognize our own mortality, again, it's back to this comfort. So if we're able to be comfortable with the idea of endings, of, challenges being part of life, not something that only the unlucky experience, If we can be more comfortable with that, then we can also embrace the possibility of joy and pleasure and,
two sides of the same coin. And if we tighten around, I can't allow myself to feel. I don't want to feel these hard feelings. I don't want to be in this devastation of this loss. I feel that if I'm unwilling to feel those feelings, unfortunately, there will be a cost in my ability to experience joy and pleasure as well.
Yeah.
And similarly, if I can open to this and allow it, allow it to do its thing.
Yeah.
Devastating as it is.
Yeah.
Being fully present to it, fully alive to it when I'm able to be, then I will subsequently also, and in fact, interweaved throughout, be also able to access joy and access pleasure and access deep belly laughs.
Yeah.
Because the fullness is everything, isn't it? It's not a case of we can pick and choose.
Yeah.
I want the full technicolor experience of the lovely things, and I'll have a small version of grieving because it's unpleasant. It doesn't work that way. Yeah.
And just to acknowledge that people experience hugely different life loads of grief. Yeah. Particularly if you come from a marginalised community in one way or another, statistically you will experience more. So, we love to have a kind of magical idea that if we've experienced a certain amount of grief in life that we won't get any more. It doesn't work like that. We don't know what's going to happen to us. But how do we face and meet the experiences that do occur? How do we face into that with integrity in some way? And I don't want to minimize the pain of it either. And huge, insurmountable devastation that often comes when people are facing grief. It's huge stuff. So let's not minimize that either, but how do we work with it? What are the tools we can use? And I love, presence, space, holding, and also to recognize that for some people the body is a painful place. So how do we bring those tools also if for whatever reason it's not comfortable to be touched, or to even bring our attention to the body? So I love this, these same tools can be used in any situation. Awareness and sitting alongside, sitting with is so important.
I think titration's really important.
Yes, great.
So there isn't one way to do mindfulness, breath work. And also, I remember years ago I worked with somebody who as a kid had a near drowning experience. And so breathing deeply for him was really, really frightening because it brought memories, still really visceral embodied memories of bringing in water into his lungs and the absolute terror of that. And so deep breathing was not relaxing.
Yeah.
So if we're wedded, again, we talked about static, we talked about, ending up kind of attached to how things should be. If you think breath work looks like deep breathing is relaxing, mindfulness looks a certain way. Well, if it's not supporting this person, it's not helpful, it's not useful. So let go of the form. How else might we use these skills to meet the person where they're at? So if the body doesn't feel like a safe place, or it doesn't feel like a safe place for a lot of depth, then it might be the person is able to be in and then we'll pop back out again. Pop back out again, of course, we're so long as we're breathing, we're in our bodies, but I mean psychologically, that sense of being able to go into the body and notice and then pop back out again when needed. Go in for as long as you can, titrate. The breath, well, okay, so even just noticing it here, or noticing it, Daniel Siegel, I really enjoy Daniel Siegel's Wheel of Awareness, where he talks about just noticing the entry of the breath at the point of the nostrils. That's such a little sensation. And just, I notice the breath as I inhale, I notice through my nose, I notice the breath just a little further back. And then I don't notice it beyond that. Okay, that's enough. That's subtle. I can be with that. But a full does not feel okay. Okay, so it's the same thing. So let's just have a small version of it then. Let's just have a little eyedropper full. So the idea of, more is better with regard to embodiment is, I think it fails to understand the necessity of titration. And it's not, again, this idea of, well, work towards. No, don't work towards anything. Just be with what is.
So I think it's worth just unpacking this word titration, which is also something we use in grief tending. We're not just diving into the point of pain and poking it. We're not just jumping off a cliff to experience our, deepest angst. We're really deliberately and carefully and gently moving very slowly towards and back again, touching in and retreating according to safety, according to what is manageable, what feels good, so that it doesn't have to be an intense experience without relief, without support, without this buffer of resilience, if you like.
And, in a way, it almost rounds us to a conclusion. At the beginning, we talked quite a bit about the body and the nervous, and you mentioned the nervous system, and the nervous system is so key in this, isn't it? Is that if we're not working at the pace of our nervous system, if we're not being at the pace of our nervous system, then that's not the kind of discomfort that I think we're talking about here. We're not talking about push oneself into X, Y, Z. We're talking about what can the nervous system bear, what can it hold. So where's within that window of tolerance of this is uncomfortable, but I'm okay. As opposed to...
So we're working in our stretch zone.
That's it.
Not in our terror zone, that we're able to step back so that we're managing our own system and learning a kind of way of working that we can then take into other situations.
And I think where we work differently is your work is grief, my work is body work, of which grief is one, working with grief, being with grief is one component. So I actually really love a session where somebody has had some grief express itself through the body in some way or another in a moment. It's been held, it's been supported, there's been space for that. And then the bodywork continues. And at the end, they walk away with a little bit of relief of, that needed to be expressed and I got to express it. And then the other 50 minutes of that was just great bodywork. And I'm now leaving with, I feel really stretched, like physically stretched. I feel like there's, some space between my bones and my muscles, and, I feel good as well, where I got to have a little bit of that expressed. And also there was a bodywork well-being broader piece happening. So again, it needn't be the totality.
Yeah.
It is always one part, even if it's quite big in the landscape at certain points in our lives. It is still one part of us too, isn't it?
Yeah.
We're not entirely defined by grieving when
Exactly.
we're in the midst of it, even at its height or heights.
Yeah. And for me, when people choose to come and do work in a group, we specifically invite them to have some support set up, or a supportive person that they can debrief with, or someone that can, to make sure they've got enough support to be able to come into a group space. And so it's really helpful for our participants if they have someone like you, someone who's able to hold maybe something that gets stirred or something they want to continue to work with. So there can be a really nice and of working one-to-one, and also then maybe something comes up in their work with you that then let's take that into a group, and then how do I continue to integrate what's coming up here, take it back one-to-one. So there can be a really nice synergy between one-to-one practitioners who understand the territory and with grief tending as a practice.
I'm really interested that we quite naturally ended up referring, I would recommend you to, and your work, amazing work, to my clients, because it just seemed really congruent with where they were at, and that you could provide something that I couldn't. And similarly, that you were sending people to me or recommending me to people, because again, it's part of that support piece. It just felt like a really natural progression. I really enjoyed this conversation with you.
It kind of feels like we've come to a natural close. Does that feel good?
I agree.
Yeah, thanks so
fantastic.
much for
Really
sharing
appreciate
your wisdom and skills. Yeah.
Likewise. Thank you.